Hi there. We want to give you a little sneak preview about how Highbar is using AI documentation through our EMR provider Prompt and Sidekick, which is through Prediction Health, and they actually integrate together. So here's what we believe. We know everyone will likely be using some form of AI documentation in the very near future. But we think there'll be some people who roll it out of the box and you have to figure it out, and there are pros and there are cons to it. And then there'll be companies like us, we're trying to be really thoughtful that it's all about how. It's about how you use it. It's about how you integrate it. We're constantly thinking about our providers and how this software, this technology can feel truly like an AI scribe or a medical assistant and not just another EMR. So I want to give you a little sneak preview about how we're using it thus far. It continues to change rapidly and we continue to customize it for our team. But here's an exciting little sneak peek. I'm going to pretend to do a quick evaluation of, well, myself. This isn't your typical evaluation. I'm going to give a quick summary of how an eval might look in a very short time, and let's see what it pulls up. So I start my auto dictation right there. Dave, thanks for coming in. I see your knee's giving you some trouble, Dave. It's been bothering you for like 6 to 12 months, gradual onset. There's no trauma you described. But it's really painful along the knee, the front of the knee, the joint line, things like that. It's getting in the way of key things in your life, right? You're having trouble squatting, you're having trouble playing pickleball, going up and down stairs can be a little sore. It can even be like 8 out of 10 pain when it's at its worst, but sometimes it helps to have some heat. I know your goals are to get back to pickleball. You want to get back to lifting up your grandkids. You haven't had any x-rays or any MRIs or any imaging or any prior treatment to this, which is great. I'm glad you came to see me first, right? So now as you hop up on the table, let's look at a little bit of everything. I've screened your hip and it looks good. I've screened your ankle and cleared it. That looks pretty good. When we dive into the knee, there's some joint line tenderness that I note on that knee. I see we have a little bit of range of motion restrictions, right? You're about -3 degrees of extension, and you have some pain at end feel. When I look at your knee flexion, that's limited to about 125 degrees. When I look at your manual muscle testing, you're about a 4 out of 5 for your quad strength. Special tests look pretty good. You have a negative McMurray's, but again, we do have positive joint line tenderness, so that can tell me a little bit. And I'm not going to miss your functional tests, of course. There's pain with stepping up, pain with step down, and you do have 30-second sit to stand. You're still able to do 13 squats, which is pretty good for your age, right? So from an overall assessment, as we start to think about what we want to do with you, I would describe this as degenerative joint changes of your knee. I know that sounds scary, but it's not that big a deal. It's osteoarthritis. But your age, the joint line tenderness, the range of motion limitations, and how the pain behaves, that's what it indicates to me. But overall, your prognosis is excellent. You're still in good shape. You're still active. These are absolutely things we can address. So our plan is to see you twice a week for 6 weeks to address all these different things. Our goals, again, are to get you back to playing pickleball. We want you to be able to lift your grandkids. You're going to go up and down stairs without any pain, and we know you're going to do just fine. So I'm going to text you all the exercises we discussed during this session. They're going to go right to your cell phone. You're going to be able to text me back through our software. We want to give you a seamless experience. I hope that summary was worthwhile. Well, I click. Let's see what it comes up with, as we've done some customizations to try to put the order of everything I just said into the note in a very simple and effective way. Again, think of this not like just any old EMR, but think of it like a scribe or a medical assistant that we want to do our job. It summarizes the key information here, and when I add, it goes right in there. There's my subjective, objective, add, it's putting it into the order with some of the things I described. My assessment, let's add it right in there. It's even using my name, referring to where I'm at. And plan, let's add that in, all right? And then we can go ahead and review that note, update the HEP, send it along. So this is the future of where we're headed. We want to be really intentional about how we're using it so that it not only decreases documentation time for our team, which is crucial, but we want our team to actually feel more joy in their day, feel like they have an assistant helping them with the lower value tasks so they can give a better experience to their patients. look forward to talking to you more about how we are using AI documentation. Thanks.